Hello, everyone. Yeah, this is the first study I'll be covering under the A-level psychology, talking about the clinical psychology. All right. So, here we're going to look at schizophrenia, which is the first topic. All right. And under schizophrenia, we'll be looking at the diagnostic criteria, the explanation, and the third category, we'll be looking at the treatment. So, let's dive into it. All right. So, schizophrenia, what is the diagnostic criteria? All right. It's a severe psychotic disorder marked by disturbances in thoughts, feelings, perception, and behavior. All right. Now, the core symptoms, which are the positive ones, include persistent delusions. All right. Delusions generally. All right. Persistent hallucination, thought disorders, experience of influence. All right. Which is also known as passivity. All right. The negative symptoms include the positive symptoms basically are like extra behavior that have been exhibited by the schizophrenic patients. Okay, but then when we look at the negative symptoms, we are talking about avolition, okay, flatten effect, impaired cognitive function, and then catatonia. So this behavior basically means a miss. All right, let me say an inability to perform certain tasks. All right. So these ones are extra behavior displayed by those people. All right. These are generally the behaviors that they are unable to, or this shows that they are unable to do certain things compared to normal human. Okay. So duration and exclusion criteria: symptoms must persist for at least 1 month and must not be attributed to another medical condition or substance. All right. If it is related to a particular substance, then it can be um, maybe an addiction or something. All right. But then if it's not related to substance, then there is a tendency for it to be schizophrenia, and it must be more than 1 month, at least 1 month. If it's something that you just experience for 1 week, then it can be categorized as schizophrenia. Yeah. All right. So what are the key terms? The ICD-11. All right. This is the 11th edition of the International Classification of Disease. All right. Used globally for coding health and mental health disorders. So it helps to identify and differentiate between different disorders that people may have. Okay. Now talking about the positive symptoms, we spoke about that. All right. Experience or distortion added to normal functioning. Right. It's more like an additional behavior, whereas the negative symptoms is a reduction or deficit in normal functioning. All right, so there is another concept which is called early onset. Now, this is the appearance of symptoms significantly earlier than the typical age range for the disorder. All right, so having schizophrenia from a very tender age, you know, that can be regarded as the early onset. Now, what are the core symptoms? Persistent delusion. Delusion basically is a fixed false belief. Fixed false belief. All right. You might want to ask, what is the difference between delusion and hallucination, right? Yeah, they seem similar. However, hallucination is a false sensory experience. All right. You experience something in your senses, whereas the delusion is just a belief system. Okay, you believe something not as if you see something, okay, or you hear something. Now when you begin to hear and you see, now it has moved beyond delusion, it's now hallucination. All right, so it can be auditory, it can be visual. Okay, you're seeing things that are not there, you're hearing voices that are not there. Right, what about thought disorder? This is disorganized thought, which is another positive symptom. And speech, okay, when people talk in an illogical manner. All right, you're just mixing ideas, mixing things together. All right, is here talking about the topic. Okay, this is how I did this thing yesterday, and then he has moved from there to yeah, what are you going to do in the next event tomorrow? Oh, my dad is going to travel, he's going to do this, and then it's mixing different ideas together. Now, experience of influence is when you feel that your thoughts and action are controlled by external forces. All right. Oh, this thing, I'm not the one controlling myself. Yeah, my action, this thing I'm doing, I'm not the one responsible for it. Okay. That is experience of influence. You can keep all those things in mind. Additional symptoms, which are the negative ones now. Avolition, which is lack of motivation. You're not just interested in anything. Flatten effect. This is reduced or absent emotional expression. All right. You might be in a comic environment. There are people laughing around, but you're just there. You're expressing no emotion, right? So that is an example of flatten effect. Impaired cognitive functioning, deficit in memory, attention to or execute function. All right. So there are some people that they are unable to just pay attention in class, for example, or there are some people that they just find it hard to be able to carry out their daily task. Okay, there are some people their memory structure is not just giving them the ability to be able to carry out maybe what other students do or what other people do. All right. So impaired cognitive functioning. All right. Another one is the catatonia. This is marked, or this marked decrease in movement or speech. Okay, decreased in movement or speech. All right. So there was a particular video I saw online. All right, it showed someone suffering from catatonia, and then I could see the person consistently hitting his face. All right, so catatonia can also refer to repetitive behavior that does not really communicate with the environment. Okay, you're just doing something for no particular reason. All right, so that can also be catatonia, or you're just staring, gazing at something without any change. Okay, so things like that, they can be referred to as catatonia. Okay, now types of delusion in schizophrenia. We have the persecutory delusions. All right, this basically talk about the idea that you're in danger whereas you're not. What is delusion again? Don't forget, delusion is false belief, right? Okay, so if someone is suffering from persecutory delusion, he continually feels that okay, he's been threatened, someone is out there trying to kill him. Okay, maybe people are just planning evil against him or something like that. All right. Another one is grandiose delusion. This is a feeling and perception that okay, you have special ability. Have you ever thought about that before? Maybe after watching um, Spider-Man movie or Batman movie or Captain America, you just feel like okay, yeah, there is a particular skill you also possess that eventually one day you'll be able to execute it, right? Maybe you can actually fly. Have you thought about that before? Okay, but I'm not saying you're already having delusion. Okay, okay, it can also be a mild form of delusion, but it's not a serious thing until it's something that really affects your behavior, your action, your emotion, and it lasts for over 1 month, right? Okay. Another one is delusion of reference. Believes that unrelated event or environmental cues have a personal significance. All right. So you're just moving, you see someone looking towards your direction, you believe that oh yeah, you're interpreting something that it refers to me. It's because of me. Okay. You go to an event center, you see someone smiling. Oh, they're probably smiling because of me. Okay, you just believe that everything is because of you, everything relates to you, the event. All right. Okay, we also have other types of delusion though that are not in this current course book. We have somatotype, when you believe that okay, some part of your brain are not functioning properly or some part of your body are not functioning properly. All right, we have things like that. Okay, we also have others, but for the sake of time, I'm just going to skip that. Okay, now case study of early onset schizophrenia. All right, early onset schizophrenia with symptoms onset before the age of 15. All right, it's regarded to as early onset. Now, symptoms of onset schizophrenia: a boy experienced a decline in academic performance. All right, academic performance, a decline. All right, and erratic behavior after family changes. All right, so that shows impaired cognitive function, right? Hallucination: began hearing voices at the age of 12. Can you see hallucination now? You hear voices. It's not just about belief, but rather you hear. Okay. Now, later attributing external communication to this hallucination. So there are other things that you begin to interpret, and you try to relate to the voices. Okay, yeah, I can hear voices. Someone is trying to call me from my village. Okay, someone is trying to say something to me, or someone is after me. I don't know, things around that. Now, behavioral changes. What are the behaviors that change? Exhibited disorganized behavior, poor sleep, and declining self-care. So this thing is beginning to affect his behavior. Okay, now treatment: hospitalized multiple times and treated with medication that controlled aggressive behavior. All right, so outcome: continue to experience negative symptoms such as apathy, okay, lack of motivation, right, social withdrawal, and school refusal. So early onset schizophrenia is actually possible, all right, before the age of 15. Okay, so that was the result of the case study on the boy. Yeah, moving forward. Research method in schizophrenia studies. How do we study schizophrenia? Schizophrenia is actually a very difficult thing to study, all right, but how can we go about it? We can use case study method, right, where we get in-depth data on a particular person. What are the advantages? In-depth information, detailed data collection, both quantitative and qualitative. You can combine them together, which can enhance understanding, right? Good. However, what are the limitations? Findings are specific to individuals or small group. Results may not be easily generalizable and replicable. So that's one particular thing about case study. The results, or let me say the theories you get out of it, becomes difficult to generalize. Okay, another way is to use virtual reality. Okay, that is very good. It's a structured and organized kind of treatment, or let me say measurement, used to investigate whether non-clinical participants exhibit persecutory ideation in a VR environment. All right, so this was initiated by Daniel Freeman. Excuse me. So we're going to look at the study shortly. All right, what is the advantage of virtual reality? When you put on a headgear and then you can just imagine certain situation in other way, in a way to test if the person is having schizophrenia. All right, so you can program a particular thing that the person will see, and you will try to note or observe his behavior. Okay, so this is a standardized virtual reality environment, enabling the study to be replicated. Okay, enhances reliability, mixed method approach, provides rich data. All right, what about the limitation of VR? VR lacks ecological validity, because what you see in the video, you're basically going to be seeing avatars, right? A lot of things that are not necessarily, or let me say, exactly human-like. All right. Also, the sample of the study isn't representative. Okay, limiting generalizability. All right. Okay, so moving forward. Now, what about the other key terms? All right, we spoke about virtual reality, computers, simulated environment. Okay, you can look at this headgear, all right, and then you begin to see certain things, right? Used in psychological research and therapy. Now, another thing is brief symptom inventory, BSI. This is very important. Okay, if you're writing your A-level psychology, please take note of this thing. If you're designing a study too, you want to carry out a study on schizophrenia, you can use this thing in one way or the other. All right, so take note of the important part of this BSI. It's a 53 item. Okay, it's a self-report. It measures assessing various psychological symptoms, which includes anxiety, depression, and hostility. Okay. Now, virtual reality study done by Freeman et al. Okay, so they used 24 volunteers, 12 male and 12 female, average age to be 26, with no history of mental illness. So this participant are regarded as non-clinical sample. All right, what I mean by non-clinical sample is that they are not people with schizophrenia. All right, so they just used normal people, right? All right, so they gave them the VR, which is the headgear, and then it produces a VR environment. The environment, what is it like? A library scene featuring avatars, so not humans, like animated images, right? Displaying ambiguous behavior. So the avatars were just displaying ambiguous behavior, such as smiling, talking. Now, if you put someone with schizophrenia, or let me say a little form of schizophrenia in it, the person will believe that, oh, they are doing that because of me, right? All right, so delusion of reference. Now, data collection. Combination of questionnaires, e.g. they used BSI, All right, they use paranoia, anxiety measures, um, and semi-structured interview. Okay, yeah, semi-structured interview. Now, the design consideration. Half of the participants completed the questionnaire both before and after the VR experience to control for priming effect. All right, so they had the questionnaire before and after. Okay, yeah, moving forward. Now, virtual reality study findings. All right, there was a correlation. Correlation between what? There was a significant correlation between paranoia questionnaire score and interview based assessment. Okay, so that is, yeah, so the score shows similarities. Now, participant reactions. While most of the participants viewed the avatars positively, majority, because they were actually normal people, right? Don't forget. So, however, there were some people, a particular category, or let me just say few participants who reported persecutory thoughts. All right? Just few participants who reported having persecutory thought. All right. So, what are the predictive factors? Higher interpersonal sensitivity and anxiety level were predicted, or let me say predictive of persecutory ideation. So, the point is when they use the brief symptom inventory, which measures a lot of behavior, it shows people with interpersonal sensitivity. All right. So, interpersonal sensitivity in this regards refer to things around. Let's say, for example, um, low self-esteem. Okay, so driven low self-esteem and some other things. Okay, like that. So it's actually made an anxiety level to, the level of anxiety actually made the people to um, have this persecutory ideation the most. All right. So, the BSI actually measures a lot of things, different things combined together. So they discovered that, okay, majority of the participants, they had no issue, coming into an environment or seeing an environment where the avatars were laughing. So it wasn't a problem for them. But however, there was few people that they discovered they had higher interpersonal sensitivity, for example, low self-esteem, all right, they had higher level of anxiety. Those people they tend to have more of persecutory thought, saying that, oh, the avatars were mocking them, the avatars were laughing at them, they were referring to them, oh, they were looking at them, something like that. All right, so moving on. Ethical consideration in schizophrenia research. All right, informed consent for that particular study by Freeman. There was informed consent, yeah. All right, ensuring participants fully understand the nature of the study and risk and potential risk. Okay. Another one is that there was thorough debriefing at the end of the study, providing comprehensive explanation and support after the study. All right. Protect from distress, implementing safeguard to prevent or minimize psychological distress during the study. All right. So wearing the headgear. All right. The environment, it's not really distressing, right? Okay. Now, what about consideration for children? Extra care is needed to protect children from harm and to ensure they understand the right to withdraw. So if you want to do this for children, you should consider that. Okay, so yeah, you can create a crossword to try to understand the different symptoms of schizophrenia, delusion, hallucination, catatonia, etc. Okay, moving forward, explanation of schizophrenia. There can be biological cause, which is genetical influence, biochemical factor, which is another one, and then psychological explanation as well. We have the abnormal self-monitoring, or let's just say lack of self-monitoring. Okay, and then we have misinterpretation of perception. Okay, so key terms in twin studies. What are the key terms? We have what is called monozygotic twins, MZ. That is identical twins, twins that look so much alike. So they share almost 100% of their DNA. Okay, look alike. You can see their facial expression is hard to identify them. They share almost 100% of their DNA. All right, dizygotic twins, they share 50% of their DNA. These are the twins that do not look alike. All right, concordance refers to the likelihood that both twins share the disorder. So what is the concordance? That is the probability of both twins having the disorder. What about heritability? The proportion of variation in a trait attributed to genetic factor. So heritability talks about how much of the thing can be inherited. Okay? Yeah. So monozygotic twins, about 100%, dizygotic twins, about 50% of their genes are the same. Okay. So talking about the genetic influence, looking at family studies, purpose, investigate if close biological relative of individuals with schizophrenia, okay, take note of that. Both relatives, I mean biological relatives, using individuals with relatives that have schizophrenia, okay, but they are close relatives, are more likely to develop the disorder compared to the larger population. All right. So the key finding: the risk increase with genetic closeness. All right, e.g., 1% in general population and 48% for identical twins, as shown by Gutzman in 1991. So what that basically means is that if you have one twin with schizophrenia, and then you test the second twin, all right, that is the monozygotic twins. Now twin, you test the second twin, okay, and then you just test someone with schizophrenia and you look at the entire population. I don't know if you're getting the point around there. Okay, you have two, that is twins, okay, monozygotic twins. All right, so you pick what is the percentage of, when you have one twin with schizophrenia, the percentage of having the other twins to be having schizophrenia, okay, that is 48%. So if one twin has, if they are monozygotic, then the other twins, there is a 48% that the other twin we have. Okay, now when you look at just someone having schizophrenia and you look at the entire general population, what is the percentage? Is just around 1%. You see? So which means that there could be genetic factors, because monozygotic twins, we said they share almost 100% DNA, right? So almost 100% genes. So which means that there could be genetic factors that leads to this high concordance. All right, moving forward. All right, so looking at the twin study done by Gottsman et al. Compare concordance rate between monozygotic twin now, which shares 100%, and dizygotic twins, which share 50%. So, example study, Ilka et al. Found a heritability estimate of 79% for schizophrenia. Okay, according to Ilka, in a study, he discovered that, okay, schizophrenia is heritable by 79%. Okay, so genetic influence, adoption study, methodology, compare the rate of schizophrenia in adoptees. Okay. Sorry. Okay. Yeah. This, according to this study, all right. So this was the result. Moving on to the adoption studies, we are just looking through all the genetical influence, how genetics can affect schizophrenia. We've spoken about monozygotic twins and general population, right? We've spoken about the heritability done by what was his name again? Ilka. All right. So now we are moving to the adoption study. Methodology, compare the rate of schizophrenia in adoptees. You know adoptees, right? When you adopt someone with their biological parent versus their adoptive family. Now, this basically talks about if you adopt, okay, this girl, for example, let's assume she's adopted into this family. Now, you look at the rate when you compare this girl with this family and you compare this girl with our biological family. You might think, oh, what is the importance of that? Now, the socialization of this girl is gotten from this family, right? Because she grew with this family. So she got a socialization, social aspect from this family, but her gene is with her biological family, right? So if she has higher, if they have higher tendency with the biological parent, that means it's genetically influenced. But if they have higher tendency with their adopted parent, that means it's socially influenced, right? Okay. So now our findings shows, according to Tiernari 2000, showed adoptees with a biological parent diagnosed with schizophrenia had a higher risk compared to control, which is their adopted parent. You see, all right. So which means there are genetic, although no genetical component is identified to be responsible. However, there is a correlation. There is a belief that there are genetic possibilities around schizophrenia. Okay, so moving forward, now, biochemical explanation, which is the dopamine hypothesis. All right. So, what is the dopamine? Yeah, it's the zeal, passion, motivation, the that hormone that makes you want to do a lot of things, satisfaction, right? Okay, now dopamine rules. Schizophrenia may involve an overproduction of dopamine. However, dopamine does a lot of things, right? Dopamine is also good, all right? It's secreted in the brain, all right? It's good. But however, schizophrenia, or let me say schizophrenic patient may have overproduction of dopamine or an increase in dopamine receptor, right? Mechanism. Dopamine acts as neurotransmitter, a chemical messenger transmitting signals across synapses. All right, synapses. I don't want to go deep into that. All right, okay, but these are the part of the brain where signals are being transmitted, exchanged. All right, so they are basically they transmit signals. All right, now what are the symptoms? Excess dopamine activity in certain brain region. For example, the Broca area is linked to positive symptoms like hallucination and delusion. All right. So that was symptoms, and then there was a link. They discovered that okay, people with excess dopamine in this part of the brain, they were also having hallucination and delusion. Okay. Yeah. What are the key terms here? What is a neurotransmitter? Chemical messenger that transmits signals between neurons. What about drug trials? Studies comparing the effect of drugs on symptoms. Post-mortem study. What does that mean? That means you examine the brain tissue after death. When someone is dead, all right, you try to check, scan through the brain, okay, to identify biochemical differences. What could be the issue with this person and every other people? Now, PET scanning. This basically means imaging using the PET machine. Now, if you check through one of our studies in the AS level, we spoke about MRI machine, right? Okay, MRI machine. There is MRI and CT, which are structural brain scan, and then we have PET machine and fMRI machine, which are functional brain scan. Okay, so moving forward, evidence of dopamine hypothesis. All right, so drug study. We're still on dopamine now. Drug studies. Amphetamines, which increases dopamine, can induce psychotic symptoms. Right? So, for example, some of the people that take these medications, cocaine and the likes, you also get to see them, hearing voices that are not there readily available, all right, or seeing things that are not exactly there. Okay, now brain imaging. PET scan shows increased dopamine receptor density in schizophrenia patient. When they check schizophrenia patient that are dead, PET shows that okay, there is increased dopamine receptor in their brain. Okay, so postmortem study, altered enzyme level responsible for dopamine breakdown found in brain tissue in schizophrenia patient. Okay, so that is another sign showing that dopamine could be an issue when it comes to schizophrenia. Okay, however, it is still a correlation. Schizophrenic patient tends to have high dopamine. It doesn't necessarily mean that dopamine is causing schizophrenia. All right, so dopamine in collaboration with other things can be responsible. Now let's look at psychological explanation. All right, so according to Fritz, it labeled that as abnormal self-monitoring. Okay, let me try to quicken the video. All right, said that schizophrenia involves a failure to recognize self-generated thought or inner speech. So according to Fritz, he believes that when you think you're hearing people speak to you, which is hallucination, is actually your inability to recognize that, for example, you're the one speaking to yourself and you believe it's another person speaking to you. Okay, so Fritz also understand, or let me say agrees to the fact that there could be biological influence in schizophrenia as well. So making this particular thing holistic. All right, I'll still cover a study on the issues and debate at the A level. Okay, now what about consequences? Hallucination. How did he explain that? Inner speech that are misinterpreted as an external voice. That is understandable, right? Delusion. Misinterpretation of self-generated perception. Okay, can lead to beliefs of alien control or thought insertion. All right, so you are the one that generated the thought. Okay, it's normal for the idea that, okay, yeah, maybe someone is cheating on you. All right, it's normal to have such thoughts. But then when you now begin to ascertain that, okay, that yeah, that is true. All right, belief of an alien control or thought insertion that, okay, yeah, this thing is really true. All right, then that is the issue with delusion now, people. All right, so it's actually a generated perception, not the reality, according to Fritz. Okay, misinterpretation of perception. Cognitive biases and reasoning error may cause patients to attribute normal internal experience to external sources. Okay, I believe that is okay. Internal experience, you're feeling it within yourself, and then you believe, okay, it's something from without, not within. Now, negative symptoms and impaired spontaneity. Difficulty in generating spontaneous action, e.g., initiating conversation, may arise from impaired self-monitoring and theory of mind. So he explained it in terms of the cognitive perspective. That, okay, it can be that your inability to relate well with people, your inability to socialize, your inability to understand what others are going through. That is what is causing the negative symptom. Okay, leads to symptoms such as avolition, lack of motivation, flattening effect, reduced emotional experience, and social withdrawal. All right, so moving on, methodological consideration in schizophrenia research, the sample size, all the explanations we've seen. Some studies have small or non-representative samples, right? So some of those studies looking at the biochemical, talking about the study by Ilka, talking about the study by others. Okay, some of them actually have few sample size, which might not be generalizable, right? What about nature versus nurture? Difficulty in isolating genetic factors from environmental influence, right? Okay, so it's actually difficult to identify that. Schizophrenia is actually a very difficult thing to study anyway. Okay, so we've already understood that there's a correlation with some genetical concept. However, we might not be able to limit it to biological aspect alone. Genetics is under biology. All right, and then the social aspect of it too, it's a little complicated to study. All right, so because there are some twins that they share similar gene, but then they do not have the schizophrenia, right? So what could be the cause? So it means that there could be environmental factors, whereas there are also monozygotic twins who share similar gene that has higher tendency compared to even dizygotic twins, which is about 7% possibility, whereas monozygotic twins, they have about 50% possibility. All right, so there could be genetic possibility, and then there is genetic possibility and environmental possibility. All right, longitudinal versus snapshot. Longitudinal study following perception over time can increase validity. Instead of just having the study at once, you can study them over a long period of time. Now, issues and debate in schizophrenia research. Nature versus nurture. While genetic evidence is strong, environmental factors cannot be entirely discouraged. Take note of that. Free will versus determinism. I'll still cover a short video on this to explain all of this. Cognitive explanations raises question about the extent to which behavior is self-generated versus biologically predetermined. All right, don't forget the study by by Fritz, okay, which is inability to monitor oneself, lack of self-monitoring. Okay, so there is a question about extent to which behavior is self-generated versus biologically predetermined. So deterministic is when you have genes that are responsible for schizophrenia. So you're already determined to be a schizophrenic patient. All right, but if you're unable to speak with people, hold conversation, which can be responsible for lack of motivation and other things, that is a free will thing. Okay, now what about generalizability? Result from twin or adoption study. Although it is informative, it may not be fully applied to a broader population due to sample limitation. All right, let's move from there. Now, treatment and management of schizophrenia, which is the last thing we're going to talk about. We've seen the diagnostic assessment, we've seen the explanation, looking at the dopamine hypothesis, looking at the genetic factor, and then we've looked at FREET, which is under the cognitive, the psychological, which is lack of self-monitoring. Now, what about the treatment? Okay, schizophrenia is complex and varied symptoms, both positive and negative, affect all areas of functioning, right? So it affects diverse area. Treatment address both acute episode, which is intense psychotic period, and long-term management for independent living, all right? So treatment can address all those aspects, okay? And long-term management rather for, long-term management for independent living. So how do you treat this? How do you treat the long-term so that the person will be able to live independently? I mean, not having the need to depend on a therapist all the time, right? So looking at the biological treatment, we have antipsychotics, okay? Now we have the first generation antipsychotics, all right? We have example to be chlorpromazine. All right, I've had a lot of students ask me, oh, do we have to memorize this name? Well, it is in two ways. If you can, go ahead. If you can't, well, it's not a problem. Just know the word antipsychotics, all right? So if you know the word to chlorpromazine, you can include it when you're describing the biological treatment of schizophrenia. So questions in A-level often come around, describe the treatment, describe the explanation, discuss, all right? So you have to memorize a lot of detail to enable you write paragraphs, okay? Right, mechanism, how does it work? It blocks dopamine receptor to reduce symptoms such as hallucination and delusion, right? Don't forget we spoke about dopamine to be a possible cause, but not necessarily a cause, right? There's a correlation. So this blocks dopamine receptor. So dopamine is being produced in the presynaptic neuron. However, it blocks the receptor in the postsynaptic neuron from receiving the dopamine, right? Now, what about the side effect of this? High risk of pyramidal symptoms, okay? Extrapyramidal symptoms, EPS, and tardive, all right, which affecting motor control. All right, so this is the side effect. You don't necessarily need to memorize these words because they are biologically related. So just take note that they have side effects that affect the motor control, ability to control your motor movement, your movement around the body. Okay, now what about atypical, which is the second generation, which is produced around the 1960s. The first generation is produced around the 1950s. All right, so we have the clozapine. How does it work? It also blocks dopamine, right? Receptor, but rapidly dissociate. Okay, it blocks the thing, but it doesn't block it forever, like for a long period of time. It blocks it at just a particular session. Okay, so allowing some normal dopamine function. So it doesn't block the dopamine, like trying to reduce it beyond the normal level. Do you get a point? So this is a kind of pattern to just block it for a few period. Now, benefit, lowers risk of severe side effect. So this is an improved version. Okay, it's effective for both positive and negative symptoms, useful for treatment-resistant patient. Now, so biological treatment generally in this situation for schizophrenia is very good when the patient do not respond to treatment. Treatment we are talking in terms of they do not respond to CBT, cognitive therapy, one-on-one conversation. So if they are not responding, then they can go through the biological treatment. All right, what about side effects? Generally include weight gain, drowsiness, and concentration difficulties. There's also a side effect, however, not like this, not severe like this. The first one. Okay, so research evidence for antipsychotics, significant improvement, randomized control trials, all right, where some participants used antipsychotic, all right, and then some participants used placebo. Okay, so in the RCT group, 50% of patients improved all right, significantly after 4 to 6 weeks. So 50% actually improved. When they say improved in their schizophrenic behavior, they're talking in terms of the fact that they're able to reduce the things they do, all right? Or like, for example, the delusion, the hallucination, right? All those things actually reduced, all right? So that is what they mean by improvement. So their behavior, positive behavior now, improved. Now, 30 to 40% had partial improvement. Please keep this result in your mind. Very important. All right. So partial improvement in this of patient, high relapse rate due to non-adherence. So relapse is like going back to the previous level, okay, going back to how they were. All right. And the reason for this is because, one issue with drug is that a lot of people do not adhere to it. They might even start taking the recommended pill, but over time they stop. All right. So this can be the reason they had partial improvement. All right. Yeah. Another treatment is the electroconvulsive therapy, which is ECT. All right. So this is basically passing electric signal through the brain. Now, historical background. Initially used in the 1930s, it belongs to the early method. Okay, early method were crude without anesthesia. Okay, anesthesia is trying to paralyze the body, all right, which can cause trauma. All right, so that was the early method. Now, the modern form of ECT involves applying electricity to the non-dominant hemisphere to reduce seizure. All right, so in the brain we have the left hemisphere and we have the right hemisphere. So basically they apply, I don't know if you've seen something like, let me use this as an example. When they're saying, doctors are using the word check, and then they place these two things in the chest and they apply that electric signal just to try to revive someone. So if you can picture that, I think that's a common thing now. So imagine passing electric signal into the brain. So it can be through electrode or whatever it is they want to do. So initially it used to be bilateral. They put it on both sides of the brain. But nowadays, the modern one, they just use it on one part of the brain. So the part that is not dominant. How do you know the part that is not dominant? Our brain and our body is cross-wired. If you have the right side of your body to be very dominant, then the left part of your brain will be dominant. If you have the left part of your body to be recessive, okay, non-dominant, all right, then the right part of your brain will be non-dominant as well. So they apply it on the non-dominant part. All right, so treatment, typically 6 to 12 sessions, often twice a week. All right, usage, reserved for acute episode. So they use it when someone is experiencing severe episode which needs rapid symptom. For example, the person could easily put himself into danger. Like I said, there was a video I watched, someone that was slapping himself continuously without stop. All right, so such a person needs quick attention. All right, so especially effective for catatonic symptom. Right now, what is the risk and side effect? Temporary memory loss, potential cardiovascular risk, very rare serious complications can also evolve from that. All right, so another reason for why electroconvulsive therapy works is the fact that they've discovered that people with epilepsy do not tend to have schizophrenia. So, and the period of manifestation of epileptic patient, there is a brain seizure. All right, so there's a brain seizure they experience. So, which means that when you pass electrical signal on participants, on those suffering from schizophrenia, you're also trying to seizure the brain from functioning. Okay, so the last one is the cognitive behavior therapy, which is the CBT. All right, overview, combines cognitive and behavior techniques together. So CBT all across the abnormal or the clinical psychology, it's basically the same, just depends on how it is used, right? Okay, so combines both behavioral technique and cognitive together. It helps patients recognize and challenge distorted thoughts, all right, which can now improve the behavior. So they try to focus on the thought and then they challenge the thought. First, they identify the thought, they challenge it, they reform it, they restructure it in order for the thought now to affect the behavior. Right, timing, often initiated after stabilizing the patient with antipsychotic medication. All right. So they try to stabilize the patient most of the time, then they use CBT. All right. So CBT is a talking therapy that helps modify dysfunctional thought and behavioral pattern. Dysfunctional thought, number one, thought, number two, behavior. So please keep this definition in mind anytime you're asked to explain the CBT explanation or treatment of something. First, you can give this definition as a way to start, and that might get you. Okay, an example study done by Sensky et al. In 2000. All right, he used research design RCT comparing random control trials. All right, comparing CBT with the befriending. Okay, befriending is actually the control group. All right, so some participants were in the CBT group. All right, some participants were in the befriending group. All right, he wants to see if CBT is effective, testing that on schizophrenic patient. All right, so yeah. Now method: 90 treatment resistant patients were used. All right, so when they mean they were treatment resistant patients, all right, they've not been responding to treatment basically. All right, between the age of 16 to 60 were randomly assigned. CBT involved discussing the onset of their disorder. All right, they discussed with the patient what is the issue, what is the reason, what caused the disorder. So it's a talking therapy. Okay, analyzing auditory hallucination and keeping voice diaries. Okay, outcomes were measured with standardized scale. Now, how did they measure that? CPRS, Comprehensive Psychiatric Rating Scale. All right, they also used another one, Scale of Assessment of Negative Symptom, SANS. All right, by blind assessors. What does that mean? That is like a double-blind placebo. Those that are measuring them do not know if this one's underwent CBT or the befriending condition. Now, the finding shows that both groups showed immediate symptom reduction. Actually, symptom reduction in the sense that their behavior now positively improved at 9-month follow-up. Okay, which shows sustained improvement were seen. Okay, now at 9-month follow-up, only the CBT group had sustained improvement, which means that CBT is effective not just for immediate situation, but it has a long-lasting effect even after 9 months, right? So befriending is also good, but we are not looking at befriending. We just want to see if CBT is effective. So CBT was used on those people. They try to check what is their behavior, and they try to analyze it after talking with them, after encouraging them, after helping them to identify. Don't forget the CBT description we gave earlier. All right. So what is the conclusion now? CBT provide lasting benefit for reducing both positive and negative symptoms of schizophrenia. Please keep that in mind. Very, very important. Okay, evaluation and consideration in schizophrenia treatment, biological treatment, advantage, effective at reducing acute positive symptoms. Okay, it can be supported by robust RCT evidence. Okay, that's random control trial. All right, the evidence we spoke about already, using medication, antipsychotics to treat was schizophrenia. Okay, we said 50% had improvement. Okay, 30 to 40 had partial improvement. Okay, now challenges: there could be high relapse rate. A lot of people had partial because there is high relapse, and they did not follow the medication well, so they went back to the behavior. Side effects can also deter adherence. Some people can have a side effect that is not making them stay, let me say, adhere to the recommendation, leading to gaps in treatment. Now, what about the psychological treatment? Where we spoke about the CBT, provides strategies for long-term symptoms management and improved daily functioning. All right, so it targets the daily behavior. It tries to replace the daily behavior too. After challenging the thought, the behavior is also supposed to be improved, right? So benefits can be sustained over a long time. Role in combination. often most effective when combined with antipsychotic. We also use CBT after you've used you can use it when you've already used the antipsychotic to calm the person, then you can engage in CBT, all right, to stabilize acute symptom before engaging in therapy. All right, so that is it. Thank you very much. I believe you've learned one or two things from this video. Okay, I wish you all the best in your study. Please try as much as possible to go to my channel. You can check my other videos, and most importantly as well, try to subscribe and check and like other videos. All right, thank you very much. I wish you all the best. See you next time.